One of the other challenges was also access to personal protective gear for the health workers, and that was both private and the public sector. Access to those was very difficult because it needed funding from both the government and also patients. They were asking patients to buy a few things, but that was not coming easy. But up till now, we still have those challenges of making sure that there is ready PPE for the health workers, which can be used in case we have any other breakouts of any diseases, depending on what it is. As long as it's an emergency that needs PPE, we still have challenges with that. One of the things that came out as a positive was that before we didn't have in the country companies that would make ready masks. Right now we do have. So at least that was one of the things that was easy to be accessed. One of the other issues that was very evident and exposed our health system was the absence of enough intensive care units. Because most of the patients who had COVID-like symptoms, especially the elderly and those who had other comorbidities like hypertension, asthma, and diabetes, had to go into ICUs, and that was a big challenge. So one of the things that made patients spend a lot of money was going into the private sector for people who had, for units that had those ICUs. The thing that happened was medicines for COVID, especially the ones that were specifically advocated for COVID management, were being sold very expensively on the open market, and even the ones that were being given out in the public sector were quite limited, so they were not enough. So that made the issues of alternative medicine become very, 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 very serious, because patients were able to use anything that they came across that was being promoted, especially on social media. And some of that created patients problems, but I think some in the long run were able to really recover with what was going on. One of the other things that emerged later is that home management, where the patient was able to be with family, be cared for, and have a better environment than the hospital setting, was found to be more effective compared to incarcerating the patients in the isolation centers. So we found that most of the patients who did home-based care effectively were able to go through the ordeal in a better and more family-centered way compared to those who were taken to the ICUs. And in a way, of course, we lost some patients who didn't have any I would say comfortable last days. They were not able to have that palliative care. Somebody is just, the family is just called to come and pick the body and the person has just died in the isolation center. So the home-based care alternative really made a lot of sense for the general population, and I think that was able to make people survive even better, because that way they were able to be with family and also access all the other things with ease compared to when they were in the isolation center. And we actually had some patients confessing in the isolation center they were having little feeding that they were not normally used to, and some didn't sleep for over a long time, and we know that when people don't sleep, their immune system also runs down. And we had patients who, the family members complained they were unable to sleep for over 2 weeks. That was quite a bit, and in the long run they passed on. For the first patients that were isolated with who were picked up with the COVID, one of the things I think because we had an old man who was about 60 years, he said in this whole ordeal, one of the things he didn't like was having to separate him from his grandchildren. And I think up till now, he has never come to terms with it, because I think the grandchildren didn't return to his home. So it was a big challenge, because they thought that grandfather will give the children COVID. Fortunately, he's still alive. But as a country, I think moving forward, we've learned a few things. In the health sector, one is to be prepared. Anything can come, which we don't know much about. Of course, there's what is going on with vaccination, with a lot of mixed feelings because of what is going on in the other world and what policies are being passed in the country. And right now, the parliamentarians are trying to make it mandatory for everyone to have vaccination. Even the other vaccinations that we do administer are not mandatory. So it is a bit surprising that for this one they want to make it mandatory, but the Parliamentary Committee on Health has been advised, and we don't know where that will take it, but that is what is going on.